Hi, my name is Dr. Taylor Soderborg, and I'm the medical director at Tiny Health. In this video, I'm going to be walking you through a vaginal microbiome test result. The vaginal microbiome is an often overlooked and very underrecognized contributor to women's health. So, whether someone is trying to conceive, is already pregnant, is having symptoms that are reoccurring or relentless, or they just want to check in, the vaginal microbiome is a critical part of health. So here we see the vaginal microbiome results from a woman who is 37 weeks pregnant at the time of testing. So when I walk you through this report, I'm going to be not only highlighting the vaginal microbiome overall, but specifically I'll highlight the key insights for those who are trying to conceive or pregnant. The vaginal microbiome is great to check in on during this phase because it can significantly increase the likelihood that baby will get seeded with beneficial microbes during delivery as long as the vaginal microbiome is in check. And this is true for the gut microbiome as well, but you'll have to check out that video to learn more about the role of the gut microbiome in pregnancy and trying to conceive. So the best place to start to understand the vaginal microbiome is the community state type. There are 5 community state types, as well as an other community state type. These are called CSTs. So CSTs are defined by the dominant type of bacteria found in the vaginal microbiome. Now, opposite to the gut microbiome, the vaginal microbiome is actually ideally not diverse. Instead, it's ideal to have lactobacillus dominating, and this is because the lactobacillus are protective. They keep the pH of the vaginal environment at a level that is harder for disruptive microbes to colonize. Now, the various community state types are associated with various conditions. So here we see that type 4B, which is a non-ideal CST, is associated with bacterial vaginosis, infertility, preterm birth. And all of these conditions do have a multitude of factors that contribute to their presence. However, it is nice to be able to check in on the factors that you, or the contributing factors that you may have some ability to alter, such as the vaginal microbiome. Now, tiny health tests are not diagnostic, but they can provide you with insights into your microbiome health and recommendations to optimize the microbiome community, especially for those who are pregnant or trying to conceive. And we recommend working with your healthcare provider in addition to tiny health testing, or even better yet, a provider who is familiar with and utilizes tiny health testing. And we do have a practitioner program to help onboard healthcare professionals to our tests, so feel free to send practitioners our way. So if we want to further understand which microbes in the vaginal community are present, we can click on the microbiome breakdown and we can see a list of all the microbes detected down to 0.05% of the microbiome. Now, at Tiny Health, we don't simply give you a list of microbes. We provide you with a meaningful interpretation of what those microbes mean at the levels they're detected at. So we break the results specifically down by category to help provide you with detailed insights. So if we click into beneficial microbes, we can see that lactobacillus is in fact present. However, it's at levels that are significantly lower than the ideal vaginal microbiome, which has levels of lactobacillus at over 90%. And you can see that for all areas that are flagged as needing support, you receive action items that you can consider taking. So if we click into here, we can see specific product recommendations and information about how this may be able to help. So similarly, if lactobacillus is low in the vaginal microbiome, now what else is there? So we can click into the balance and robustness and see that diversity is in fact high. So instead of having dominance of one protective lactobacillus, we have low lactobacillus and high diversity. So if we click into the disruptive microbes section, we can see a lot of different insights that can be very helpful for people to understand their symptoms. So we have metrics measuring microbes related to bacterial vaginosis, aerobic vaginitis, ureaplasma, and sexually transmitted microbes, as well as yeast infection related candidas. Now, again, it's very important to note that this is not a diagnostic test, and we strongly encourage any results that are out of range to be followed up with a practitioner for definitive diagnosis and treatment. Tiny Health is incredible, though, for providing insights for people who have been facing reoccurrent infections or those who find that sometimes their symptoms get worse with treatment. So, for instance, total aerobic bacteria, there's not currently a way to test for this in some more conventional settings. But aerobic bacteria, which is low in the sample, but when higher, may mimic the symptoms of bacterial vaginosis. However, when given antibiotics, it actually allows for these aerobic vaginitis related microbes, E. coli, staphylococcus, streptococcus, to actually increase and make symptoms worse. So, for those who have been potentially misdiagnosed or not found a solution to their symptoms, have found relief in doing a tiny health test to identify the dominance of aerobic bacteria in their vaginal microbiome. Similarly, for those who have found low lactobacillus in their microbiome, they've realized that their recurrent infections were potentially due to the fact that their microbiome community couldn't keep these disruptive microbes out. So they found themselves in a cycle of symptoms, treatment, symptoms, treatment, symptoms, treatment that just kind of never ended. And so by identifying the low lactobacillus, they were able to get more to the root cause of their recurrent infections and be able to support their whole vaginal microbiome community to make it harder for those infectious microbes to recolonize. For those who are pregnant or trying to conceive, having an understanding of the microbiome health can reduce the risk of recurrent UTI because things like aerobic bacteria can increase the risk of UTI. Or potentially identifying the presence of ureaplasma may be related to things like infertility or preterm delivery or bacterial vaginosis. Research is early on that in that phase, but it can be very helpful to identify the microbes that may be increasing the risk of infections because infections during pregnancy may require antibiotics, and antibiotics may reduce the friendly bacteria and increase the unfriendly bacteria that are seeded to baby during delivery. So optimizing vaginal microbiome health either during delivery or either to reduce the likelihood of infection during pregnancy can be very beneficial. Lastly, we have conditioned biomarkers for preterm delivery. Now, preterm delivery is multifactorial, but reducing the contribution of the vaginal microbiome to this risk is ideal. So if we click in here, we can see that there are microbes associated with decreased risk and those associated with increased risk. And taking the actions recommended by the Tiny Health Action Plan may help to reduce the microbiome's contribution to the risk of developing this condition. So for any areas that are flagged or need improvement, we will provide actions that people can consider taking to optimize their vaginal microbiome. Everything from lactobacillus supplements and vitamin recommendations to educational guides on the vaginal microbiome and conditions. We also provide insights specifically for those who are pregnant or trying to conceive and to provide insights for things they can do following delivery or leading up to delivery to continue to work on their and their baby's microbiome health. So, for example, did you know that there are probiotics that can help reduce the symptoms of mastitis? Or probiotics that can help improve iron uptake during pregnancy? Or perhaps unplanned C-section happened, or even a planned C-section happened. We provide you with insights on how to support your baby's microbiome to help recover from that. Lastly, we also have recommendations on actions you can take to help reduce the risk of preterm delivery and gestational diabetes. Again, we strongly recommend working with your healthcare practitioner as this is not diagnostic or therapeutic. However, these actions can absolutely help to shift your microbiome and improve your vaginal and gut health. All right, so a year after delivering her baby, Maria did a follow-up vaginal microbiome test. And while her vaginal microbiome does continue to need some support, we do see that she was able to shift her community state type from one dominated by unfriendly bacteria to one dominated by lactobacillus. Specifically, this is Lactobacillus iners, which is not quite as stable as Lactobacillus crispatus or Lactobacillus gasseri. However, it can help to keep the disruptives in check. So with this change in CST, we can also see that overall, there was an increase in lactobacillus. We went from 6% all the way up to just about 32%. So these are changes in a positive direction and are helping Maria's vaginal microbiome to be prepared for future pregnancies, as well as maintaining her own vaginal microbiome health.